morning. The topic of my presentation is mechanical plaque control. Plaque control is defined as a removal of microbial plaque. It is divided into mechanical and chemical plaque control. Mechanical plaque control includes oral hygiene, methods like toothbrushes and dental cleaning devices. So the gingivitis developed in 2 to 3 weeks and resolved within 1 week, and periodontitis is often, if not always, preceded with gingivitis. The mechanical plaque control aids are toothbrushes and dentifrices. Interdental aids are dental floss, interdental brushes and wooden tips, and aids for gingival stimulation are gingival massage and water irrigation devices. The goals are maintenance of gingival and dental health. The plaque retentive factors has to be removed. Toothbrushes are the most widely used oral hygiene aids. According to American Dental Association on Dental Therapeutics, the toothbrush is designed primarily to promote cleanliness of the teeth and oral cavity. In ancient days, chew sticks were used by the Babylons. The toothbrushes that was developed was miswak era, then there was celluloid era and power toothbrush era. Going on to the history of toothbrushes, in 1600 the toothbrush was used in China, followed by the Western world 1640. The handles were made up of gold, ivory or ebony, and the toothbrushes, nylon toothbrushes was introduced in 1938 and power toothbrushes in 1960. The objectives of toothbrushing are cleaning and interdental spaces and of food remnants, prevent the plaque formation, and to stimulate and massage the gingival tissues. These are the parts of the toothbrush where you have the head, shank and the handle, and the parts of the head include the toe and the heel. ADA specification of the toothbrush is the toothbrush has a length of 1 to 1.25 inches, 5 to 12 tufts per row and 2 to 3 rows of bristles, and it has got the width of 3 by 8 inches. The toothbrushes are classified into hard, soft, natural, synthetic, multi-tufted and space-tufted. Toothbrush bristles are classified based upon the soft, medium and hard diameter into 0.2 for soft, 0.3 for medium and 0.4 for hard bristles. The toothbrushes are of two materials, one is nylon and it can be multi-tufted brushes, monofilament or multi-filament brushes. Types of toothbrushes you have manual toothbrushes, power toothbrushes, sonic, ultrasonic and ionic toothbrushes. These are the different handle designs, and this is the design of the head. This is the filament pattern. This is the end of the toothbrushes, bristles. The amount of brushing time is optimally 2 minutes. And the frequency of brushing, almost every day we need to brush twice daily, and the overall benefit of twice daily cleaning is derived from mechanical plaque removal as well as adjunctive chemical benefit. The manual toothbrushes are easy and effectively manipulated, it is durable and inexpensive, and it is conforming to the individual patient requirements. The modifications of manual toothbrushes are long and contoured handle, double angulation of the handle and concave surface of the brushing plane. This is the difference between an adult and the pediatric toothbrushes. Power toothbrushes was introduced in Switzerland during the World War II in 1960s. It is having 3 different generations. The first generation is powered by electricity battery. Second generation is vibrating, reciprocal, rotating head movements, premiumly priced, rechargeable with pressure sensor heads and brushing timer. Third generation is sonic. Power toothbrushes were introduced in Switzerland, and it mimics the manual toothbrushes. It is an automatic mechanical electric toothbrush. It is indicated in young children, handicapped patients, individual lacking manual dexterity, for prosthodontic and endosseous implants, orthodontic patients, and institutionalized patients including elderly patients and patients on supportive dental therapy. The advantages are increases the patient's motivation, resulting in better patient compliances, increased acceptability in interproximal and lingual tooth surfaces. The sonic and ultrasonic toothbrushes have high frequency vibrations of 1.6 MHz. Laser toothbrushes are available where the gel contains peroxide and oxygen bubbles occurs with the laser light is applied. These are the brushing techniques, which includes the roll technique, vibratory technique, Phone's technique, Leonard's technique, scrub and Smith's technique. Bar's method, it helps in cleaning the plaque from the beneath the gingival margin, open interproximal areas and cervical areas. The advantages are it removes the plaque from the proximal areas and cervical areas. It is easy to master and provides good gingival stimulation. Disadvantages are you require manual dexterity is required. Charter's method, the bristles are placed at an angle of 45 degrees to the gingiva with the bristles directed coronally. Indications are large interproximal embrasures, moderate interproximal recession following periodontal surgery, and massaging of the marginal interproximal gingiva. Disadvantages are incorrect method causes laceration of the alveolar mucosa. In modified Charter's method, there is an occlusal sweep that is given, similar to the Charter's method. It provides stimulation to the attached and marginal gingiva, flush the capillary beds with the tissue through the applied pressure, and displacement of food and debris. Disadvantages are tissue laceration, ineffective for plaque removal and time consuming. The Leonard's method, brush vigorously without great pressure with a stroke that is mostly up and down on the tooth surface with just a slight rotation or circular movement. Smith's method, the toothbrush follows the physiological pathways and the foot follows with its transverse over the tissue in a natural masticatory act. The stroke is directed down over the lower teeth onto the gingiva and upward over the teeth for maxillary area. Horizontal or the scrub method, the bristles are directed perpendicular to the long axis of the tooth. The dentifrices that is used are toothpaste, tooth powders and gels. Dentifrices minimize plaque buildup. It has an anti-caries action, it is a mouth freshener. It is mainly composed of polishing agents, binding, then detergents, humectants, flavoring agents, sweeteners, antibacterial agents and anti-caries agents, anti-calculus agents and desensitizing agents. Tooth brushing technique is classified into roll technique, vibratory technique, circular, vertical, horizontal techniques. The interdental cleaning aids are used for gingival embrasures, open furcation areas, for the fixed and orthodontic appliances. The embrasures are classified into type 1, healthy, type 2, where 75% of the embrasure is occupied by the gingiva, type 3, 50% of the embrasure is occupied by the gingiva, type 4, 25% embrasure is occupied by the gingiva, type 5, complete loss of interdental papilla. The dental floss has got multifilament, it is twisted and non-twisted, bonded, non-bonded, thick and thin, waxed and non-waxed. The different methods of flossing, one is the spool method and other one is the circular method. The interproximal or interdental brushes are cone-shaped and cylindrical brushes suitable for cleaning the large irregular concave surfaces adjacent to the wide interproximal interdental spaces. Type 2 gingival embrasures that is used clean the furcation and root concavities. It is inserted through the interproximal spaces. Unitufted and single tufted brushes are used. Wooden tips are triangular in cross section. The base of the triangle is facing the gingiva. Toothpicks are substitutes to dental floss for interproximal open spaces. Interdental brushes are used in orthodontic appliances, dental implants, fixed prostheses and dental fabrications. The gingival massage is the mechanical stimulation of gingiva by tooth brushing or interdental cleansing that increases the keratinization, blood flow and JCF fluid. Irrigation devices are used, that is adjunct to the tooth brushing. Tongue scrapers are also used for removing the plaque from the tongue. Thank you for the